everybody. I'm Dr. Afzal. I'm honored to be here, actually, especially with yourself, the Honourable Keith Vaz. It's a pleasure to meet you. So in terms of the vaccine itself, so the BAME community, so a bit of background basically. So, we know through the pandemic, we know what coronavirus is. We know it's a respiratory condition. We know it affects anybody and everybody. And it's very, very important in the BAME community because lots of research, lots of studies have shown that it's disproportionately affecting the BAME community. There's many reasons for that. One of the reasons is actually we live in extended families where there's 3 generations often in one house. Often the younger ones will be key workers, doctors, nurses, taxi drivers, shop assistants who'll go out. They're more likely to catch COVID. They're more likely to bring it home to their elderly relatives. We know that unfortunately, a lot of South Asians live in deprived areas. There's a lot of poverty, and we know that obviously increases your risk of any infection because of the close proximity to other people. And of course, the other important thing is with this being a diabetes forum, we know that diabetes is a multi-organ condition that affects not only your blood sugar levels, but actually affects a lot of organs, your heart, your eyes, your circulation. So if the BAME community contract coronavirus, they're actually more likely to end up needing intensive care. They're more likely to end up dying, and this is an important message that we actually have to get across to people. People tend to think that it's the elderly that are dying from coronavirus, but actually if you look at the average age on patients in intensive care, majority of them are around 60 years old, and 60, that's nothing in my eyes. Physiologically, you have at least 20 to 30 years ahead of that. And the other thing, of course, is that actually we make up, the BAME community to make up only about 16% of the population, but 1/3 of us are actually in intensive care with coronavirus. So that goes to show that definitely there is something about us, our genetic makeup, the fact that we're predisposed to conditions like diabetes that put us at that higher risk. So that's really important to emphasize, first of all, because then that makes it even more important to have the coronavirus vaccine. Now, at the moment, we've got 2 vaccines available. We've got the Oxford one, which is also known as AstraZeneca. We've got the Pfizer one, which came out slightly earlier than that. And both of them actually have shown a fantastic results in terms of reducing transmission of coronavirus and preventing serious illness. So the Pfizer one was actually introduced in Israel before it was introduced in England. And they've recently done a study of 600,000 patients that have received the Pfizer vaccination, albeit they've received both doses 3 weeks apart. But they found that 92% of patients did not contract symptomatic coronavirus at all. Now, whether maybe possibly some of them have had asymptomatic coronavirus transmission, possibly. It is, in theory, it's possible you can still catch it after the jab, but the whole point is it stops you from getting unwell, it stops you from needing hospital, and stops you from dying. So that's really, really encouraging. And it's encouraging that actually there seems to be something that's stopping you actually catching it as well. Now, unfortunately, there's lots of myths around the vaccines, sadly, that have circulated on social media. And that's definitely put off a lot of the BAME community from coming forward and having the jab. So in my experience, I know that when we've called up our patients, the ones that are most likely to decline are the patients from Afro-Caribbean backgrounds and also the South Asian patients. But actually, I found that when I've called them myself and tried to explain, and it's taken 5 or 6 minutes to explain the importance of the jab, they tend to come forward, and then they tend to accept that actually it will be of benefit to them. And I mean, as a doctor, as a clinician, what I don't want to see is that we know that we have this distrust in the vaccine, and the only reason it's going to be expelled is once we start seeing actually the rest of the population is now surviving, but it's the South Asians and the Black community that we're seeing a lot of deaths in, which could have been completely preventable. So with the hesitancy in the vaccines, I mean, there's lots of reasons. Now, with a Black community, historically, unfortunately, there's been studies done, usually in America, where they've used Black patients almost as guinea pigs. So there was a famous study done in the 70s where patients had syphilis, which is a sexually transmitted infection but can cause multi-organ failure. So what they did in that study was they told these patients of Black origin that they would get treatment for their syphilis, and actually they didn't give them any treatment. They gave them a placebo with nothing in it, because what they wanted to see was what happens to patients who don't have any treatment for syphilis. Unfortunately, a lot of these patients then went on to die. A similar study in Nigeria, again, where children with meningitis weren't given any treatment, again, Black children who could have been saved with treatment. So there are these things historically which makes you understand why the Black community certainly aren't happy about having the vaccine. With South Asians, again, there is that distrust in the government, because I think people have always felt that each time Caucasians are put first in everything, be it jobs, promotion. So why is it this time the government's actually specifically targeting us? And to that, I would always say, and I always say to my patients that, you know, I completely understand where you're coming from if you think that the pandemic's been handled badly, or but you have to trust us as doctors. We wouldn't advise anything that's unsafe. In the studies for these vaccines, yes, only 45 to 50,000 patients were trialed, but now 16 million nearly have been vaccinated with either Pfizer or Oxford. We haven't seen any major adverse effects. We've seen a couple of patients with the Pfizer jab initially who had anaphylaxis, which is like a severe allergic reaction, but actually those patients were already known to have allergies, so it wasn't new for them. They'd previously had one, but now we know not to give that particular vaccine to people with allergies. We give them the AstraZeneca one. So that's one thing. In terms of people say that we would rather catch coronavirus because not many people will die from it, but from the vaccine there's side effects. I mean, that's not true. So the vaccine will give you, like any other vaccine that you've had, would give you a bit of a sore arm. I've had both of my jabs. I had a bit of a sore arm, a bit of a temperature, maybe some aches and pains, but that's just your body reacting to the vaccine and producing a response, and that's what we actually want. So that is what we are training our body to do. The whole point of the vaccine is the vaccine doesn't contain anything that's not alive. It contains a dead part of the virus, and all that does is it injects that dead part of the virus into your body so that your body recognizes it next time. Your body will have this immune system ready and waiting, so that when it comes into contact with coronavirus, it's there ready to fight it away. So that's how these vaccines work. Both of them work with the dead viruses, so they can't cause coronavirus. I mean, the other things, the myths that there are, that it contains alcohol or it contains pork or cow products. It doesn't contain any meat products. The other thing I've commonly hear is aborted fetal cells, that it contains aborted fetal cells, which simply isn't true. I mean, back in the 1970s when there were vaccines, yes, they did use aborted fetal cells as a medium, but now they clone these cells in labs. So they make copies of them. They aren't actually aborted fetal cells. And whatever cells they use, as soon as they enter your body, they don't interact with your own body's DNA. They will actually just disintegrate and go away, leaving you just with your body to build up an immune response. And one of the other things, obviously, we get said a lot is infertility. There's no reason why any vaccine should affect infertility, but again, it's just one of those that's preventing a lot of young women who are healthcare workers getting the vaccine. And unfortunately, we've just recently seen some data from Leicester Royal Infirmary, where they've done a study in their hospitals. They've got 3 hospitals, and they've actually found that only 57% of South Asians have come forward. South Asian staff, including doctors, nurses, have come forward for the jab. Only about 35% of the Black community have come forward for the jab. And that's actually quite worrying, because if as a healthcare worker you're not confident, then how do you promote the safety to everybody else? And particularly because these healthcare workers are at most at risk. I mean, I lost, right at the beginning of the pandemic, I lost a family friend, Arima Nasreen, who was actually she was the first nurse to die of coronavirus, and she was only 38 years old. No underlying major illnesses. She had pre-diabetes, so not quite diabetes, but wasn't on any treatment. So it shows that it can actually affect any of us. Yes, compared to the population, only 1% die, but actually it could be any of us. And as I said, the age of 60 isn't really, you know, it's not a age that people should be dying. We know that we've lost lots of healthcare workers. We know we've lost lots of patients who bus drivers, taxi drivers, shop workers who've been in contact with the virus. And I think it's very important that we, you know, if the other thing I say to my patients is if you get called up for the vaccine and you don't want the vaccine, or you've got your reservations, then still come for your appointment, because we sit there, we consent you, either a doctor or a nurse will talk you through the vaccine, will tell you about the side effects, and will answer any queries. At that point, you can always still say no and decline it. No one will force you to have the vaccine. But I know that sometimes reception calls up, they don't know much themselves in terms of the scientific things and much about, obviously they don't have much time either to go through everything with the patient on the phone. So I say to them, if you can't get in to speak to your doctor or nurse before you come for the vaccine, just book in for the vaccine, come anyway for your appointment. No one will jab you as you come through the door. You'll be consented, you'll be given an information leaflet, you'll be talked through all the side effects of the vaccine. And for that reason, you can discuss whatever concerns you have. And, you know, rightly so, people do have concerns, because even myself, to be honest, when I read back in October, I think it was an article in the newspaper saying we're nowhere near a COVID vaccine, then 2 months later, wow, here come about 3 of them. So there are, but then when you realize actually a lot of people have got together across the world and shared information, people have been working day and night in laboratories to get this vaccine going, you realize actually it is possible. With the global effort that we've had, with the global funding, the vaccines managed to be quite quick, because we've bypassed a lot of the kind of administrative stuff, which sometimes you would sit on for months. So that's, you know, that would be the answer to people who say that it's come too quickly. And again, of course, as I've said, with the studies from Israel only the other day about the effectiveness of the Pfizer jab, that's really, really encouraging. If we look at the graphs now of the deaths, and actually, if you look at the graphs, if you look at the decline in deaths, if we see that the over 80s are actually declining more so than the 70s, because they were the first ones to get the vaccine. So that, again, that shows that those that have been vaccinated are protected. And the protection won't come straight away. Your body will take 2 or 3 weeks. So that's my brief. I don't think there's anything in terms of the vaccine itself that I wanted to